My message would be that the process worked pretty much as it was supposed to. I pre-registered when a couple days in advance, when it was announced that my age quartile would be eligible. And 2 weeks later, I got a notice that told me I was eligible to make an appointment, and we're here today.
Governor,
The process is working.
a lot of friends of mine have said when they got vaccinated, they found it to be an emotional experience. Kind of reflecting back on where we've been. You just got vaccinated. Did you feel a little emotion there? Not just the shot in the arm, but after all of it?
I think for all of us here in Massachusetts, around the country, and probably around the world, this has been a year unlike any other, and it's been filled with a tremendous amount of heartbreak and anxiety and lost opportunities and at the same time, tremendous acts of kindness and grace. But I think for all of us, there's simply no question that the arrival in such a short period of time of a vaccine that works is a giant sigh of relief. And I have heard the same thing from friends of mine who've been vaccinated. I heard it from my father, who said that getting vaccinated was, for him, it was the first signal, the first sign that he might actually be able to hug his grandchildren. And I think for all of us, one of the biggest and most emotional elements that's associated with getting vaccinated is the possibility and the opportunity to once again be able to show some love and affection to those we care about most, who for the most part, you know, if we've been playing by the rules, we've been pretty much staying away from for the better part of the past year.
Governor, am I right that you received the Pfizer vaccine?
Yes, you are right. How did you know that, Jonathan? I did receive the Pfizer vaccine. Oh, did you really? Okay, yeah.
J&J is coming here, but it's
Yeah.
not here yet. So for those who might still be reluctant, you touched on this during your remarks. As you set an example as the leader of the state, how can you reassure people that, hey, I got it, it's safe?
Honestly, I've said all along that I think the most important person you can probably talk to about this would be your own clinician. Because clinicians believe in the vaccine and want to see people get vaccinated. I think the other thing I would say is just look at what's happened to case counts and to hospitalizations among those over the age of 75. I mean, if you just go back to January, you don't even have to go back to November or December. If you just look at the data from January forward, the number of people over the age of 75 in Massachusetts who are testing positive has dropped like a rock, and the number of people who have ended up in the hospital has also dropped like a rock. And at that same period of time has been the period of time when, for the most part, we focused on those people who we were most concerned about, the most vulnerable and the most senior among us. And that's not just been true here in Massachusetts, that's been true pretty much everywhere. And I think it's a big statement about both the safety of the vaccine. Remember, these are the most vulnerable people among us that we've been vaccinating. And secondly, the success rate it's shown with respect to reducing both their hospitalizations and death and cases in the first place.
Governor, there had been some concern about like Easter gatherings and Passover gatherings leading to a surge. Do you think we might see that, and when could that happen?
Usually we're talking maybe 7 to 10 days after the events. And I think, you know, frankly, our data has been relatively flat for the past few days, but obviously we're going to pay a lot of attention to that. I do take some comfort from the fact that when I look at the national data, I draw two conclusions from it. The first is we continue to test a lot more than many other parts of the country, which means we are catching positive cases as a result of our testing program. People in Massachusetts do appear to continue to be getting tested. That's really good, because that's in many respects how you identify cases. But the second thing is even among states that have case counts on a per capita basis that are similar to ours, or even in many cases significantly below ours, our hospitalization rates per capita are actually lower than many of those states, which says that we are catching cases and we are keeping people out of the hospital as a result. And I do think the fact that such a significant portion of our over 75 and over 65 population has been tested, has been vaccinated, has also helped there as well.
Governor, there's a vaccination clinic taking place in Russell Auditorium, sort of a free-for-all type of thing that people can walk in and get that vaccination. Did the administration sort of squash that because people were just walking in, weren't really eligible? This is an area that has been hard hit, trying to fulfill those appointments. Your take on that?
So first of all, that clinic is run in partnership with Boston Medical Center, and Boston Medical Center has been a champion of partnering with local-based community organizations, faith-based organizations, community health centers, and others to do outreach into communities of color and into those parts of Greater Boston that have been most disproportionately affected by COVID. And I talk to the CEO there twice a week, and she always updates me on how they're, not just how they're doing with vaccines, but how they're doing in vaccinating some of the populations that they and we are most concerned about getting vaccinated. I think what happened yesterday, I would refer to as an honest mistake. People have been talked to. I don't anticipate it will happen again, that they will follow the rules and play by them as everyone else who's vaccinating people in Massachusetts should. But Boston Medical Center and the partners they've been working with have really done a great job of reaching a lot of communities and a lot of people who we need to reach.
So should people wait if they're not eligible?
Pardon me, Paul?
People wait if they're not eligible then to get that vaccination?
Well, the whole point behind the way the eligibility criteria was established in the first place by our vaccine advisory board was to make sure we got to many of the communities and many of the people who were most disproportionately affected by COVID and most vulnerable to it. And I think our program overall has been quite successful in doing that, and it's borne out, as I said, by the hospitalization data that we see here in Massachusetts. I would also say that, you know, we have been trying to make sure that each phase gets a significant opportunity for those who want to get vaccinated to get vaccinated. We plan to be open to everybody by April 19th, which, by the way, I was glad to see the President decided to pick April 19th too. I was terrific that he followed our lead. And I think one of the things that's important to remember here is the percentage of our population that's gotten a first dose, the percentage of our population that's fully dosed is significantly above almost every other state in the country and is #1 among all states that have more than 5 million people.
Is the First Lady going to get hers? Did she get hers?
The First Lady pre-registered and then got an appointment at CVS and got dosed about a week ago and unregistered as a result of that. I think most colleges are probably going to discuss whether or not they want to make a vaccine sort of a requirement of coming back to school in the fall. I think it's going to be an issue they're all going to talk about. I think the thing that's important to remember on that is not every college kid, well, every college kid probably will qualify to get vaccinated at some point starting in April or May, and they should. I mean, for their own sake and for the safety of themselves and their families and their fellow students and teachers and staff.
Do you think we're going to be able to reach herd immunity given the amount of infection we're seeing in the under 30 crowd? April 19th comes. Is that going to be a big push? Let's get the young people vaccinated and then reach that level where we're all safe?
I think, well, first of all, remember that part of the reason why the percentage of young people who are, why the percentage of people who are testing positive among younger folks is going up is twofold. Number one, there's been a really significant reduction in the number of people over the age of 60 who are testing positive. I mean, if you look at the raw numbers overall, we're still way below where even the folks under the age of 50 were in January and February, okay? I mean, we have a little bit of a dip, a little bit of an uptick in March, but we're still way below where we were earlier in the year. I think the message I would send would be, you know, if you talk to the folks in the hospital community, they're thrilled that they aren't seeing as many older folks as they used to see, but they will definitely tell you that they are seeing younger people, folks in their 30s, 40s, and 50s in the hospital. And this is not the time for people to let down their guard. People should still pay attention to the rules and do the things that have prevented the spread and kept people safe from the beginning. And when you have a chance to get vaccinated, when your term comes up and you become eligible, go get vaccinated.
Thanks, everybody. The Washington Post had an article today linking some of the infections among younger people to youth sports, high school sports. Is that something that you're looking at, keeping a close watch on, and should youth sports may consider skipping the season to get over this hump?
So we spend a fair amount of time. First of all, we have a lot of rules and a lot of guidance around youth sports. In fact, we have guidance on a lot of things where there's not guidance in many other places. And they were developed in conjunction with our reopening advisory board and some of the healthcare folks that we talk to on a pretty regular basis. We do track what's going on with youth sports. And you may recall earlier this year, we basically shut down youth hockey for a couple of weeks and changed many of the rules and the guidelines associated with both tournaments and interstate play because of the rising cases we saw associated with that. And if we see significant issues and problems with some of this stuff, we deal with it. The flip side of that is I have to say, we've made it through a fall sports season and a winter sports season with people playing by the rules and doing what they were supposed to do. And for the most part, case counts were pretty low. It actually worked pretty well. And it gave kids, many of whom, haven't been able to get out of the house at all, something to do. And I think for a lot of them, it was a really positive, not just physical development, emotional development as well. Bruce?
On Friday, your administration withdrew the air permit for the biomass facility comes in Springfield. Everybody able to get a sense of your administration is always also pushing RPS regulations to subsidize such facilities. Are you withdrawing those as well?
Those are currently under review. I think the issue with the biomass facility was we felt it just simply wasn't, where it was in the process wasn't consistent with the terms and conditions of the original approval, which took place, I think as most people know, if they've been following this issue, in the Patrick administration. I mean, that's how far back this thing goes. A lot's happened since then.
But the letter of your agency also raised some environmental issues.
Yep.
I wondered, the subsidies, are you going to put those aside too?
I'm not going to speak to that until we actually promulgate, but we'll be promulgating on that shortly.
Thanks, everybody. I just wanted to ask about revenues. They continue to come in over benchmark, including in March, where there was more than revenue collections total more than $3 billion, almost 27% above benchmark. The House Ways and Means budget is due any day now. Do you think that we should be shifting away from that big draw on the rainy day account, given the fact that revenues are coming in so high?
I would think that by the time we get to the end of the year, we'll see where we are, obviously, but the rainy day fund was there. A lot of us worked really hard over the last few years to triple the size of the rainy day fund so that it would be there when it was raining. And I think one of the things we'll definitely talk to the legislature about is, and we have talked a little bit with them about it at this point, is about replenishing the rainy day fund, because it's really important that Massachusetts continue to have, for the future period, a very robust rainy day fund. It really proved its mettle early on in the pandemic.
Thanks, everybody.
Thanks, everybody. How's your arm?
How's your arm feel?
Feels fine so far, although I got to tell you, it's a real shot.
Governor, do you have a second appointment here? Did you book a second?
I did, yeah.
For 3 weeks?
Yep.
Here.
And I got 65 text messages telling me that I booked the second appointment. The system is wired.